The government has launched a new system which will share crucial information between the NHS and social care services. It's hoped it'll better protect vulnerable children and those caught up in knife crime. The Health Secretary unveiled the system at the official opening of a new emergency department at Croydon University Hospital earlier today. Sonia Jessup reports.
Smiles from one of the youngest patients today for the Health Secretary's photo call. He was at Croydon University Hospital to tour their new A&E and to roll out a new system across London aimed at protecting vulnerable children.
When somebody arrives in hospital with a knife injury, then they're at a moment that they are receptive to support, to counselling, to all the wider support that's needed to, if they're involved in a gang, to get them out of a gang, get them out of knife crime.
It works by automatically alerting social services as soon as a vulnerable child turns up in A&E. This emergency department opened in December, costing £21 million. It's 30% bigger than their old site and designed by the doctors and nurses.
Most emergency departments can't have a lot of windows because of privacy and dignity, but where we've managed to, we've dragged in as much natural light. You can come to work in an emergency department and not know what's going on outside from the minute you walk in to the minute you leave, and shifts can be up to 12 hours long, so that's an awfully long time. So we tried to give it space.
The department's dedicated to two former nurses. Hasina Fowl and Audrey Cross both lost their lives to cancer, but have inspired others to follow in their footsteps.
I've been a nurse for nearly 8 years now. I've taken it from her. My mum and dad are both nurses, and seeing how much they enjoyed it, I think that's what's made me become a nurse.
But even this brand new department is already struggling to meet demand.
If we had to go back and then build it again, then we'd probably need a suite of 6 rooms.
Treating thousands of extra patients, a month after opening, waiting times actually got worse. The Trust says it's improving, but there's more to be done.
The numbers of patients coming to the hospital and being seen in emergency care is going up, over 10% increase in that. And obviously we've got to respond to that with staff and facilities. Now we've got a bigger department. We now need to make sure we get the staffing to support that.
After 3 years on a temporary site, staff say the new building is a joy. They're convinced patients will benefit too. Sonia Jessup, BBC London News.
Now, it's a vote very few expect